Good morning. Major news out of the United States, where the nation's health department has significantly scaled back its recommendations for childhood vaccinations. This move has sparked widespread concern among medical professionals and led to legal challenges from multiple states. The U.S. Health Department announced it is reducing the number of immunizations suggested for all children, specifically striking rotavirus, influenza, and hepatitis B from the routine schedule. Under these new guidelines, vaccinations for these diseases would only be recommended for children deemed to be at particular risk. This decision was revealed by Health Secretary Robert F. Kennedy Jr.'s department in early January. The response has been swift and strong. 15 states have already announced their intention to file a lawsuit against this newly restricted government vaccination plan for children. These states, largely led by Democratic administrations, argue that the new recommendations by Health Secretary Kennedy Jr. and the Centers for Disease Control and Prevention, known as the CDC, disregard decades of scientific research and will ultimately make the children in America sicker. California Attorney General Rob Bonta voiced these serious accusations on Tuesday, outlining the concerns of states, including Colorado, Michigan, New Jersey, and Wisconsin. These states believe the changes represent a dangerous departure from established public health practices. Health Secretary Kennedy Jr., who has served under President Donald Trump for approximately 1 year, initiated this controversial review. He tasked the Vaccination Commission with re-evaluating rules that have been in place for more than 30 years. Robert F. Kennedy Jr. is the nephew of former President John F. Kennedy and is known for expressing views that link immunizations with conditions such as autism in children. It is crucial to note, however, that these claims are not scientifically proven and contradict the consensus of the global medical community. The backdrop to these policy changes is a noticeable increase in vaccine skepticism across the United States. Public health experts are issuing urgent warnings about the potential for a resurgence of potentially deadly diseases, many of which were previously considered to be largely eradicated. These warnings are not without precedent. Just last year, the United States experienced its largest measles outbreak in more than 30 years, recording over 1,400 cases. This alarming event serves as a stark reminder of how quickly vaccine-preventable diseases can return when vaccination rates decline. In the United States, certain vaccinations, such as those against measles, mumps, and rubella, are currently mandatory for school enrollment in many areas. Other immunizations are strongly recommended by health authorities. However, a significant loophole exists in numerous states where parents can obtain exemptions for their children from these requirements, often citing religious reasons. This flexibility, combined with growing skepticism, contributes to varying and sometimes dangerously low vaccination coverage rates in different communities. The decision by the U.S. Health Department to curtail recommended childhood vaccinations, despite widespread scientific consensus and strong opposition from numerous states and public health experts, marks a critical moment for public health in America. The potential implications for children's well-being and the broader public health landscape are substantial, setting the stage for a profound debate on the role of government, science, and personal choice in protecting the health of the nation's youngest citizens. Stay tuned for more updates on this developing story. This video was generated using artificial intelligence. Thanks for watching. If you enjoyed this video, don't forget to give it a thumbs up and subscribe to our channel for more updates. See you next time.